They have an extreme capacity to absorb the shock when you run, when you jump, or even for that matter, walking. Suppose you weigh around 65 kgs. That body weight is absorbed by this meniscus. So whenever there is a meniscus tear, that function, the shock absorber function of that meniscus drops down. It's like just like driving a car without no shock absorber. The same way, the walking, the running can be very rough without the shock absorber, and that can lead to a permanent damages like severe arthritis, and which may subsequently need a knee replacement.
Welcome to Health Inside Out, a Kauvery podcast. Alright, you're tuned into Fever 104 FM. This is Cheyenne on the Superhero Show, and it's time on the show for Health Waves by Kauvery Hospital, Marathalli. Every Thursday on the show, I'm joined by a doctor from Kauvery Hospital, Marathalli, and today I've got Dr. Raghu Nagaraj here in the studio with me. Sir, thank you so much for coming back again.
Hello, Cheyenne. Thank you for having me here. It's always a pleasure to be with you in the studio.
And it's always a pleasure to speak to you. So before we go ahead, if you could kindly introduce yourself once again for anybody who is listening to you for the first time on radio.
Yes. Hi, I'm Dr. Raghu Nagaraj. I'm the Director, Department of Orthopedics, Joint Replacement and Sports Medicine at Kauvery Hospital, Marathalli.
All right. Sir, we will talk about sports injuries on the show today. A lot of people have taken up fitness. A lot of people are into sports. January is the month when a lot of people take that decision that this year I'm going to be fit. Now, with fitness also comes injuries. Why? What are the most frequent injuries you see in people in Bangalore who have taken up sports or fitness, and why do knees seem to take the hardest hit?
Yes, Cheyenne, you're absolutely right when you said that, January is the month when people enroll into the gyms, fitness
Right.
clubs and all. So what happens is over a period of time, they wouldn't have done much exercises. They wouldn't have been very active. So all of a sudden, they decide to get fit and they start getting involved themselves in all these sporting activities. When they
Right.
do that, the joint and the muscles wouldn't be ready for that. So it's always important for them to get prepared themselves first, do proper warm-up stretches, undergo, a couple of physiotherapy sessions or a good rehabilitation sessions, and then, subject themselves to all these hardships.
Right.
Then get into physical activities. So because of which there's very high chance of risk involved because the muscles and joints, ligaments are not prepared for these physical activities.
Right.
And when they get involved in these physical activities, that's when they injure themselves. And why knee is more important is because see, knee is the one which where the when athlete or in person who are into physical activities, they use knee to pivot, to take turns. They do sudden turning. It could be football or it could be badminton, anything where they do sudden turning movements.
Right.
It's based on the knee pivoting. The pivot happens at the knee. And knee has a lot of structures inside it, which are inside the joint, like a meniscus, which is a shock absorber of the joint, or there are two important ligaments inside the knee called ACL and PCL. In short form, we say that, but full form is anterior cruciate and posterior cruciate ligament. So these are the structures inside the joint. So they are at risk of getting damaged when you are not prepared the knee to get involved in those sporting activities. So that's the reason why knee injuries are more common, and we treat knee injuries a lot.
All right. Speaking about which, so anybody who is just taking up fitness or anybody who's regular to fitness, would you advise stretching as something that they should do every single day before workout, after workout, before sports, or because again, there is a school of thought which says stretching probably does not prevent injuries as well. So what is your say on that?
Yes, it's a two different school of thoughts, I would say. But yes, stretching is it's of paramount importance. Why? Because as I said, if you have not done any physical activities for a long period of time and suddenly want to get involved in either lifting weights or any kind of sporting activities, your muscles are stiff. And suddenly when you do some activity, it might develop a micro tears. And
Okay.
also when the muscles are stiff, they're not very much reflexive. Suppose if you're running or if you're jumping or if you're playing sport, if you lose balance, then those stiff and the tight muscles are not capable of preventing the fall.
Right.
And that ends up in people losing balance, and they end up damaging the structure. So that's why stretches are important. But I will not say that stretches is the only thing that is important. You have to add on stretching with strengthening exercises followed by proprioceptive or rehabilitation, what we call pilometrics. You need to learn single leg hopping. You need to learn balancing on the wobble board. All these things will improve your reflexes. So all these three things put together, stretching, strengthening, followed by pilometrics. Pilometrics, we can talk in detail about it. It's more of a proprioception or reflex improving exercises.
Okay.
All these things put together, what protects you from injuries.
And I'm guilty of that same. In gym sometimes we have a lot of these small aches, right, which we think will go away with time. Let's say we're specifically talking about knee pain. What are the dangers of it if left being untreated for quite a bit?
Yes. Yeah. To start with, see, definitely when you start with gymming activities, it is bound to have some pain, what we call as a muscle soreness, because
Right.
you would be doing it after a long time. That is quite normal, and that which generally goes away with time. So one should be very careful to distinguish between a regular muscle soreness following a workout and a pain which comes after a mechanical damage or a structural damage to the knee joint. So yes, if there is a muscle soreness, one can do regular stretches and get away with it. So after a period of or a bout of rest, they get better.
Right.
A pain which is niggling or a sharp pain which comes at the same point again and again, and every time it comes with activities and takes extra time to go, and also the intensity keeps increasing, or the for different symptoms follows that pain, like
Right.
after a period of pain, then the swelling may come up, and the joint may become little stiff, or one can even start hearing some clicks or crepitus inside the knee. So they're all extra symptoms which follows the pain. So whenever some people or any people faces these symptoms one after another, that's when they should be really careful of, and that should not go neglected. So if there is a period of pain continuously coming again and again, so they should get evaluated to see if the pain is not coming due to structural damage or not.
All right. You also specialize in something called the meniscus repair. For those who aren't familiar, can you explain what meniscus is? Why is it important for the knee?
Yes, Shayan, that's a very good question that you have brought up, because meniscus is a structure a lot of people are not aware of actually. People have heard about ligaments, people have heard about cartilage, but hardly people have heard about meniscus.
For us, we've only heard it in newspapers when they talk about meniscus tear for sports persons and all of
Yes,
that.
absolutely. So meniscus tear is what we call as a shock absorbers of the knee joint. There are two
Okay.
meniscus inside of a knee joint. One on the inner side, what we call as a medial meniscus, and one on the outer side, what we call as a lateral meniscus. They purely act like a shock absorber. It's spaced between the two bones, the thigh bone and the leg bone. They're basically like a C-shaped fibrocollagenous structure.
Okay.
They're made up of fibrous tissue, but they have an extreme capacity to absorb the shock. When you run, when you jump, or even for that matter walking, your body weight has certain, suppose whatever you are, suppose you weigh around 65 kgs, that body weight is absorbed by this meniscus. So that's what keeps our knee joint smooth. So whenever there is a meniscus tear, that function, the shock absorber function of that meniscus drops down depending on the intensity of the tear. If the tear is really bad, the function of the shock absorber may get reduced to close to 70-80%. So then imagine the amount of wear and tear the knee undergoes without the shock absorber. It's like just like driving a car without no shock absorber. You can imagine how rough the journey
Right.
can be. The same way, the walking, the running can be very rough without the shock absorber, and that can lead to a permanent damages like severe arthritis, and which may subsequently need a knee replacement.
So, when it comes to meniscus tear, are only athletes at the risk of meniscus tear, or anybody who is also into workout for that matter, or just normal activities, can they also have meniscus tear?
Yes, not only athletes, anybody are or exposed to this risk of meniscus tear, because see what happens is meniscus is there between the two bones,
Right.
and whenever you jump and land, if you don't land in a proper form, or whenever you lose balance during turning movements, so that piece of meniscus can get crushed between the two bones and they develop a tear.
Oh.
In certain, especially older people like between 40 to 50 who would be having early arthritis, their bones would be slightly rough in the initial stages.
Right.
Those patients, those kind of population have even more easy tendency to develop a tear. Even if they're sitting from a chair and try to get up, they might tear their meniscus. A lot of people come to me with 40, 50 years old, and they hear a pop when you sit and get up, and they neglect it. And then slowly the pain increases, and the knee would be going towards a severe arthritis. So meniscus tear can develop in any people, and it can develop due to twisting injuries. And in older people with a small strain also it can develop. So everyone is exposed to the risk of meniscus tear.
So, once a person has had meniscus tear, what are the treatment options available?
Yes, yes, Shine. See, meniscus tears can be of various types and also various severity. So there are many types of meniscus tear, like a longitudinal tear, complex tear, or a very bad bucket handle tear. They're all depending on the types of tear. If you talk about the severity of the tear, there are three types, like grade 1, grade 2, and grade 3, depending on how from minor to major. So this is evaluated and diagnosed by using an MRI scan first. So once we decide the type of tear and the the grade of tear, then we start the treatment. For a minor tears like grade 1 or grade 2, and who are people who are not actually into a sports or not playing professional sports, we prefer to treat them conservatively. Like we give them a period of rest, we give them a knee support, and we'll give them some medications to help in healing that. Once they recover from that initial injury or the initial phase of pain, then we'll subject them to a proper rehabilitation protocol. Once they regain back their muscle strength and once the pain is gone, on examination there is no sign of residual meniscus tear left behind, then we allow them to go back to active lifestyle.
So basically, in this case, the meniscus repairs itself through rest and rehabilitation.
Absolutely, yes. But that can happen in a minor grades like grade 1 or grade 2. In grade 3, where there is a complete tear of the meniscus,
Right.
which could be of various variety, like I has explained before, these cases need repair. Because meniscus don't have self-healing capacity, especially if it's grade 3 plus. So in these cases, we take them for an arthroscopic meniscus repair, like a small keyhole surgery. It's a minimally invasive technique where we'll make it two tiny holes around the knee and put the pen camera kind of thing. And once the camera goes, you'll get a picture on TV. So looking at the TV, we can repair every type of tear. This technique and this concept was not there a decade ago. But this evolved over a decade ago because we realized the importance of meniscus. In earlier years, see, I've been practicing sports medicine since 2009. In those years, when we were doing these surgeries for ligament in the meniscus, we used to reconstruct the ligament, but not the meniscus. We used to trim and take off the meniscus because the repair technique was not there.
Right.
Then we realized that these patients whom the meniscus has been trimmed, they're coming back with arthritis. So that's when, since a decade, everywhere the meniscus has been repaired. However bad the tear is, we can still repair it because the technique is so advanced now and using this minimally invasive technique. So repair is a good concept. Every meniscus needs to be repaired and every meniscus needs to be saved. So it's a big Save the Meniscus campaign going on all over the world globally. Especially you must have seen, the Rafa Nadal, for example, he underwent meniscus surgeries. So meniscus can impact your career. Either
Did Rishabh Pant also go through the same thing as well?
Yes, Rishabh Pant had to undergo ligament surgeries also along with that. Because most of the times when the injury is bad, these meniscus tears are accompanied by these ligament injuries like ACL and PCL, which are the main ligaments of the knee joint. So whenever we are conducting surgery for ligaments ACL and PCL, most of the time they are associated with meniscus tear as well. So we always have to repair that meniscus. So repair is the second option for grade 3 and all. That's the best option for grade 3. But in certain scenarios, Shine, where the meniscus tear is so bad that you cannot salvage it, or in certain scenarios, patient has already undergone one surgery in some other place where they would have trimmed the meniscus. As the repair concept is still picking up, a lot of surgeons are still going and trimming those meniscus. So some young patients, if they have got this meniscus completely trimmed, they would start developing early arthritis. So in such exceptional cases, we even now do meniscus transplant. That means we take the meniscus from the donor and we're transplanting it to this patient who has lost their meniscus and who wants to go back to the physical activities.
Right.
So conservative treatment, repair in most of the tear cases, and transplant in exceptional cases. These are the treatment options available for these meniscus tears.
I mean, once a person has had meniscus surgery or meniscus replacement for that matter, is it possible for them to go back to their original life, as a sports person for that matter, or workout or whatever?
Yes, yes. Again, it's a very important question because whenever an athlete or whenever people with meniscus injury come to my OPD, that's the first question they ask to me that whether can I return to sports after this surgery or not. Yes, definitely they can return to sports, especially if they seek the treatment at the right stage. If it's not neglected, if the tear is not really bad, then definitely when we do the repair or even conservative treatment in the initial stages for grade 1 and grade 2 tears, as I explained earlier, these patients, they do really well because the repair success rate has definitely picked up. Now it has reached the percentage of 90 to 95% when we do it at the right time. because now the technique is advanced. We have various armamentarium in our hospital or infrastructure with which every type of tear can be repaired.
Okay.
And that with a minimally invasive technique. So all these meniscus, they do really heal well. But yes, having said that, just repair alone is not enough. Once we do the repair, they need to undergo a thorough rehabilitation protocol. They need to regain back their strength, they need to regain back their range of motion, they need to regain back their reflexes. That's plyometrics, what I said earlier.
Right.
So once they are done with all this protocol, and then when they satisfy our return to sports criteria, we have certain criteria. Once an athlete or once the person who has undergone meniscus tear or ligament surgery, if they satisfy all these criteria, then we let them go back to sports. It may vary from a period of like 6 to 8 months to 10 to 12 months depending on the type of injury. But yes, most of these athletes at the end of their like 10 months or 12 months period of rehabilitation protocol following a surgery, they will be able to return back to their sports comfortably to their pre-injury level. Yeah.
All right. Doctor, before we let you go, can you tell us some common activities that maybe all of us do that is harmful for our knees, and as well as some things that we should all do, regardless of if you work out or if you're not a sports person for that matter, which will be good for our knees as we get into the old age, let's say?
Yes, I'm sure. I think this answer is going to help
Right.
the general population to take care of the knee. But yes, what I would suggest is don't start anything all of a sudden. All right, everything has to be started in a gradual way. If you have not done any physical activities, you have not involved yourself in any kind of sporting activities, then start slow. Prepare yourself first. Make sure you stretch and get back your full movements. Make sure your muscles are nicely flexible and free. Then only you start playing or getting back to sports. Once your stretching is done, you always have to maintain your knee strength. You have to do regularly some basic quadriceps and hamstring strengthening exercises, and your hip exercises like glute muscles. They're also important. Even for that matter, your core, the abdominal muscles are also very important. So you need to strengthen every muscle groups regularly. So if you keep your joints prepared with these strengthening regular exercises, then you can continue to play for the whole life. You can be very much active.
Okay.
And for older people who already have a lot of arthritis in the knee joint, they also can do some basic exercises. Even when they're sitting on a chair watching TV, they can just lift the leg in the air, hold it for 10 seconds or 5 seconds and relax. This simple exercise itself will strengthen the knee muscles, and that itself can benefit them to a great extent. So on and off regular stretches, regular strengthening exercises will definitely keep the knee healthy and strong. That what prevents from injuries. Coming to the things that you're not supposed to do is like certain activities, like it could be a deep squat, or it could be like if you're not, as I said earlier, if you're not done anything, then it's also starting those activities all of a sudden. Those are all the activities which will increase that expose
And
them
when you
to
did
risk. Yeah.
speak about deep squat, that is not only in the gym,
Yeah.
but also in the washroom.
Yes, yes,
Right?
yes.
Because there is a school of thought which says that is the best way for anything, and that is good for your legs, and that is good for your knee, that is good for your glutes, as well as the digestive system.
Yeah, so that's as I said earlier, it's a different school of thought, because they feel that when you deep squat, you're actually increasing your range of motion completely. That helps the joint, but not for them who have never done any activities. So straight a person who has never done any physical activities, if he goes and do this deep squats, he will develop this meniscus tear, so the cartilage damages. So first he has to stretch thoroughly, increase the muscle length, make it free, and then you can involve this. But doing these deep squats and all for a long period of time is always a risk. So do it for a limited period of time. Like I would say 10 to 20 minutes of this sitting cross-legged or deep squat definitely helps, but provided you have been also doing stretching and strengthening of the knee joint regularly. Doing deep squat alone without these stretches and strength is definitely harmful, I would say.
Okay. All right. Dr. Raghu Nagaraj, thank you so much for coming to Fever 104 once again. Your interviews are always, very informative, and you explain things very simply. So you did that today as well. Thank you so much, and I would love to see you back in the studio soon again, sir.
Thank you so much, Ryan, for having me here. It's always good to spread information about our knowledge, which a lot of people are not aware of it. And always, it's always a great pleasure to come and having a chat with you, and you make us feel so comfortable. So
Thank
looking
you.
forward for the next session. Yeah.
Thank you, sir. That was Dr. Raghu Nagaraj from Kauvery Hospital, Marathali. This was Health Waves by Kauvery Hospital, Marathali. We will take a short break, and there's much more coming up, so stay tuned.